Cannabidiol, or CBD, is one of at least 113 active cannabinoids identified in cannabis. Tetrahydrocannabinol, or THC, is the primary psychoactive cannabinoid in the cannabis. CBD is a major phytocannabinoid, accounting for up to 40% of the plant's extract. Cannabinoids are considered to have a wide range of potential medical applications. This is due to clinical reports showing a lack of side effects and a non-interference with learning and psychological function. They've also been shown to have antidepressant, anxiolytic, and neuroprotective effects. The endocannabinoid system controls emotional responses, behavioral reactivity to context, and social interaction. The enhancement of the endocannabinoid signaling can enhance serotonergic and noradrenergic transmission, increase cellular plasticity and neurotrophin expression within the hippocampus, and it can dampen activity within the neuroendocrine stress axis. Some benefits to activating the CB1 receptor. It can prevent aging of the brain, suppress the mast cell activation response. It has beneficial anti-ischemic effects, and it reduces gastrointestinal transit time. It plays a role in fear extinction. It helps with anxiety. It increases growth hormone. It inhibits glutamate and GABA. It increases CCK and ghrelin release. It decreases prolactin, and it lowers stress. It helps with sleep. It increases brain-derived nootropic factor. It increases myelin. It lowers inflammation and permeability in the gut. And it increases the PPAR expression. Some of the negatives: it may participate in tumor formation in the brain. It may interact with the circadian rhythm. It may impair memory and increase fatigue. It may decrease acetylcholine and glutamine. It may contribute to anxiety in alcohol withdrawal. It may decrease bone density, increase liver fat. It may lead to obesity and metabolic disorders. It may decrease thyroid hormones. It may raise cortisol, lower adiposity, inhibit CAMP, and it can affect mitochondrial energy. Some benefits of activating the CB2 receptor. It stimulates the opioid receptor. It regulates lipid production and cell death. It inhibits the release of pro-inflammatory factors. And its activation helps with Alzheimer's and Parkinson's disease. On the negative, the CB2 receptor is expressed in several types of inflammatory cells and immunocompetent cells. The CB2 is upregulated in autism, and CB1 is downregulated, and it inhibits CAMP. Recent studies indicate a natural cannabinoid from cannabis, specifically CBD, increases adult neurogenesis. Cannabinoid reduced amyloid beta, induced neuroinflammation, and it promoted hippocampal neurogenesis. The repeated administration of the CBD increases the hippocampal progenitor proliferation and neurogenesis in wild mice. In mice, chronic THC exposure increased brain-derived nootropic factor in the hippocampus, but not in the frontal lobe. The activation of both CB1 and CB2 receptors have beneficial effects in Alzheimer's experimental models by reducing the harmful beta-amyloid peptide and the tau phosphorylation, as well as by promoting the brain's intrinsic repair mechanisms. CBD inactivated the amyloid precursor protein, although THC is considerably superior as an inhibitor of amyloid beta aggregation. In iron-treated rats, chronic cannabidiol improved recognition memory. CBD might have potential as a preventative treatment for Alzheimer's disease, with a particular relevance for the symptoms of social withdrawal and facial recognition. Adding CBD to Alzheimer's disease patients was safe. There have been studies also showing no efficacy in Alzheimer's disease. The acute and chronic administration of cannabidiol increases the mitochondrial complex and creatine kinase activity in rats' brains. CBD produced significantly better intracranial pressure or cerebral perfusion pressure without jeopardizing the blood pressure. CBD protects against the vascular damage that's caused by a high glucose environment, inflammation, or the induction of type 2 diabetes in animal models, and it reduces the vascular hyperpermeability that's associated with such environments. CBD was shown to reduce anxiety in patients with social anxiety disorder by inducing activity in the limbic and paralimbic brain areas. It also helped with public speaking-induced anxiety. CBD has anxiolytic and possibly antipsychotic properties. The CBD was associated with the activation in the right temporal cortex during auditory processing. During visual processing, the CBD increased the activation relative to placebo in the right occipital lobe, with maxima in the middle and inferior occipital gyri, and the lingual gyrus and cuneus. Proper endocannabinoid signaling modulates the hypothalamic pituitary axis. Stress induced the downregulation of the hippocampal ECB signaling. What's interesting, just like microdosing, is repeated exposure to the same stress can sensitize the CB1 receptor, and this can result in dampening of the stress response. The endocannabinoid system is suggested to be dysfunctional in mood and related disorders. In comparison to placebo, CBD improved emotional face affect recognition at 60% emotional intensity. CBD induces antidepressant-like effects comparable to a prescription antidepressant. Also, it exhibited an anti-anxiety and antidepressant effect in animal models. Endocannabinoids play a role in blood pressure regulation in depressives with higher blood pressure. CBD receptors are expressed in several types of inflammatory cells and immunocompetent cells. Activating CB2 receptors inhibits the release of pro-inflammatory factors. CBD treatment resulted in an increase in brain-derived neurotropic factor expression in the hippocampus and decreased levels of pro-inflammatory cytokines in the hippocampus and the prefrontal cortex. Ischemia reperfusion is a pivotal mechanism of liver damage after a liver transplant or liver surgery. CBD significantly reduced the extent of the liver inflammation, oxidative nitrative stress, and the cell death. Myeloid-derived suppressor cells, or MDSCs, are one of the main regulatory cells in the immune system. While the MDSCs induced by CBD in the liver consist of granulocytic and monocytic subsets at a ratio of 2:1, the monocytic MDSCs were more immunosuppressive compared to the granulocytic MDSCs, so this might help in certain autoimmune conditions. The cannabidiol restores the liver function, it normalizes 5-HT levels, and it improves brain pathology in accordance with normalization of brain functions. In glaucoma, the increased release of glutamate is a major cause for retinal ganglial cell death. The cannabidiol has been demonstrated to protect the neuron cultures from glutamate-induced death. The endocannabinoid system has been implicated in the regulation of bone metabolism. Cannabidiol ligands regulate bone mass. CB1 and CB2 receptors have a protective effect against age-dependent bone loss in mice. The administration of CBD led to an improvement in fracture healing. In humans, polymorphisms in the CNR2, the gene encoding CBD2, are strongly associated with postmenopausal osteoporosis. Therefore, CB2 agonists like CBD enhance the endocortical osteoblast number, helping with osteoporosis. Recent studies find at least 18% of adults report receiving insufficient sleep. Adults with chronic sleep loss often report excess mental stress. CBD can help with insomnia as it significantly decreases subjective anxiety and increases mental sedation. REM sleep behavior disorder, or RBD, is a parasomnia characterized by the loss of muscle atonia during the REM sleep and it's associated with nightmares and active behavior during the dreaming. In a small study of 4, the CBD was able to control the symptoms of the REM sleep behavior disorder. CB1 receptors are present in mast cells. Activated CB1 receptors present in the mast cells suppress the degranulation by inducing sustained camp elevation. The activation of the CB2 receptors, like taking CBD, attenuates the nerve growth factor-induced mast cell degranulation. Sativex is a combination of CBD and THC in equal parts. It's approved in Canada for the treatment of central neuropathic pain with multiple sclerosis and intractable cancer pain. In patients with a GL-YR dysfunction, the cannabinoids might be effective for the treatment of chronic pain. Dyskinesia is a movement disorder, and it's characterized by the involuntary muscle movements, including movements similar to tics or chorea, and its diminished voluntary movements. CBD decreases the amount of the key enzymes that can cause dyskinesia. In mice, when a TRPV1 was combined with CBD, it reduced the symptoms of dyskinesia. There's mounting evidence for the therapeutic use of CBD in human neuropathic pain conditions. CBD helps with neuropathic pain. It's also been shown to help with neuropathic pain in multiple sclerosis. Escalated sebum fabrication is seen with an unattractive look, and it adds to the growth of acne. A CBD cream reduced the skin sebum and the erythema content. The activation of the endocannabinoid system controls a proper and well-balanced proliferation, differentiation, and survival, as well as immune competence and/or tolerance of skin cells. Therefore, CBD might be an effective treatment for multiple pathological conditions and diseases of the skin, like acne, seborrhea, allergic dermatitis, itch and pain, psoriasis, hair growth disorders, systemic sclerosis, and cancer. Medical cannabis laws are associated with significantly lower state-level opioid overdose mortality rates. Drug addiction is a chronic relapsing disorder characterized by the compulsive desire to use drugs and a loss of control over consumption. CBD can have therapeutic properties on opioid, cocaine, and psychostimulant addiction. CBD reduced cigarette consumption in tobacco smokers. It reduced nicotine withdrawals. It inhibited the reward facilitating effect of morphine. It reduced the amount of time that rats self-administered heroin. CBD prevented neurotoxicity in rats from alcohol binging. The CBD was an effective treatment of cannabis withdrawal symptom from THC. Interestingly, CB1 antagonism prevented neurochemical and behavioral deficits induced by chronic PCP. Mad cow disease is a fatal neurodegenerative disease in cattle, and it causes a spongy degeneration of the brain and the spinal cord. The disease might most easily be transmitted to humans by eating food contaminated with the brain, spinal cord, or digestive tract of the infected carcass. However, the infectious agent, although most highly concentrated in the nervous tissue, can be found in virtually all tissues throughout the body, including the blood. CBD prevented the prion accumulation, and it protects neurons against prion toxicity. A number of abnormal physiological processes occur simultaneously in ALS. Cannabis appears to have activity in all of these areas. Cannabis has powerful antioxidative, anti-inflammatory, and neuroprotective effects. Prolonged neuron cell survival, delayed onset, and slower progression of the disease. Cannabis also has properties that are applicable to the symptom management of ALS, including analgesia, muscle relaxation, bronchodilation, saliva reduction, appetite stimulation, and sleep induction. Anorexia nervosa has the highest mortality rate of psychiatric disorders. It's been associated with different alleles of the CB1 gene. CBD affects leptin and ghrelin. The endocannabinoids affect the liver's ability for the secretion of hormones regulating appetite and satiety, leptin and adipocytin, lipogenesis, adipogenesis, obesity, and insulin resistance via the CB1. In anorexia nervosa, short-term weight gain is associated with a disproportionately increased leptin secretion. Ghrelin acts as a natural antagonist to the leptin. Circulating ghrelin levels are increased in illness-induced anorexia. Ghrelin and endocannabinoids exert oxygenic effects, and this may facilitate nutritional restoration. The effects of cannabinoids appear to be biphasic, as they can stimulate as well as inhibit food intake, depending on the preparation and the dose being used. All 5 major cannabinoids inhibited MRSA, Staphylococcus, and Streptococci bacteria. Cannabinoids, mostly THC, were shown to inhibit disease progression through pleiotropic effects on inflammatory cells. Cannabidiol has immunomodulating effects, and this helps to lessen the progression of atherosclerosis induced by high glucose levels. Activation of the CB2 receptor inhibited atherosclerotic plaque progression in mice. In animal models, CBD treatment effectively blocked the progression of arthritis. Also, because of its anti-inflammatory properties, the CBD can also help with rheumatoid arthritis. Asthma represents a public health problem and traditionally is classified as an atopic disease, where the allergen can induce clinical airway inflammation, bronchial hyperresponsiveness, and reversible obstruction of the airways. Both CB1 and CB2 receptors are involved in lung protection. The activation of the CB1 receptors on the bronchial nerve endings has bronchodilator effects by acting on the airways to smooth the muscles, and this can be beneficial in airway hyperreactivity and asthma. Autism spectrum disorder is a complex behavioral condition with the onset during early childhood, and it has a lifelong course in the majority of cases. It's characterized by deficits in communication and social interaction, as well as by stereotypic behaviors, restricted pattern of interest, and abnormal sensory issues. Altered neurodevelopment during early pregnancy represents the neuropathological cause of autism spectrum disorder. Alterations of the endocannabinoid system can contribute to the autistic phenotype. Cannabis has long been known to limit or prevent nausea and vomiting from a variety of causes. THC and CBD may help by exerting sedative, hypnotic, anxiolytic, antidepressant, antipsychotic, and anticonvulsive effects in patients with bipolar disorder. Enteric glial cells actively mediate acute and chronic inflammation in the gut. The glial cells proliferate and release neurotrophins, growth factors, and pro-inflammatory cytokines. They can amplify the immune response, representing a very important link between the nervous and the immune system in the intestine. CBD can control the activation of these enteric glial cells. Cannabinoids can be a helpful therapy for the treatment of colonic inflammation. The dysfunction of the endocannabinoid system can contribute to the development of migraine attacks. Activation of the endocannabinoid system can reduce migraine attacks. Diabetic retinopathy is a leading cause of blindness among working-age adults. CBD inhibited p38 MAP kinase in the diabetic retina. Marijuana, including CBD and THC, is associated with lower levels of fasting insulin, as well as smaller waist circumference. In both humans and mice, blocking the CB1 can increase insulin sensitivity. Oxidative stress and inflammation play critical roles in the development of diabetes and its complications. CBD reduces reactive oxygen species, neurotoxicity, inflammation, and BRB breakdown in diabetic animals by inhibiting the p38 MAPK. It also lowered the incidence of diabetes in young, non-obese, diabetic-prone female mice. CBD can also be used to retard beta cell damage in type 1 diabetes. THC may serve a protective role against hyperlipidemia and hyperglycemia in diabetes. There's an increased risk of acute pancreatitis among type 2 diabetic patients. CBD significantly improved the pathological changes of mice with the acute pancreatitis. The hypothalamo-neurohypophyseal system plays a role in homeostasis under a variety of stress conditions, including endotoxemia. CB1 receptor is expressed in the hypothalamus and the pituitary gland, and its activation is known to modulate all of the endocrine hypothalamic peripheral endocrine axis. The endocannabinoid system modulates the reward properties of food by acting at specific mesolimbic areas in the brain. The endocannabinoid system dysregulation has been associated with the development of dyslipidemia, glucose intolerance, and obesity. CBD is beneficial in the cardiovascular system. It's been shown to be antiarrhythmic in animal models. It protects against the vascular damage caused by a high glucose environment, inflammation, or the induction of type 2 diabetes in animal models. In vivo, CBD treatments protect against ischemia reperfusion damage, against cardiomyopathy that's associated with or without diabetes. Also, CBD has been shown to reduce infarct size and to increase blood flow in animals after a stroke. It can also normalize blood pressure. Cisplantin is one of the most potent chemotherapy agents available to treat various malignancies. Nephrotoxicity is a common complication of cisplantin chemotherapy, and this involves increased oxidative and nitrosative stress. The treatment of mice with cannabidiol markedly attenuated the cisplantin-induced oxidative, nitrosative stress, inflammation, and cell death in the kidney, and it improved the renal function. Recreational cannabis use in adults with epilepsy is widespread. Severe childhood epilepsy is characterized by frequent seizure, neurodevelopment delays, and impaired quality of life. Epilepsy is the most common neurological disorder, with over 50 million people worldwide being affected. Endocannabinoids and their receptors are altered by epileptic seizures. Studies suggest that cannabidivarin might be an effective treatment for epilepsy. In a double-blind, placebo-controlled study, CBD was able to reduce seizures in drug-resistant epilepsy. In one study, 4 of the 8 CBD subjects remained almost free of convulsive crises throughout the experiment. 3 patients demonstrated partial improvements in their clinical condition, and it was ineffective in 1 patient. In another study, 7 out of the 8 epileptics receiving the CBD had improvements of their disease state at 200 to 300 milligrams per day. Although in another study, CBD did nothing at the dose of 200 to 300 milligrams per day for epilepsy. CBD may only be effective in 3 types of epilepsy: grand mal, cortical focal, and complex partial seizures. Motion sickness and stress in humans is associated with impaired endocannabinoid activity. Enhancing the endocannabinoid signaling might represent an alternative therapeutic strategy for motion sickness. Dexamethasone has widely been used for the prevention of nausea and vomiting after chemotherapy and surgical procedures to treat the motion sickness. The dexamethasone alleviates motion sickness in rats, in part by enhancing the endocannabinoid system. In mice, CBD inhibited obsessive-compulsive behavior in a time-dependent manner. Cannabidiol was able to reduce the food intake in rats. THC or THC-CBD combination might produce a weight loss effect and might be a useful therapeutic for the treatment of obesity and its complications. It might even help weight loss in diabetic patients. CBD might be useful in the prevention of obesity as it promotes browning of the white adipocytes and augmentation of lipolysis, thermogenesis, and reduction of lipogenesis. Although THC can make you hungry by increasing leptin and ghrelin. Parkinson's disease has a progressive course and is characterized by the degeneration of the dopaminergic neurons. The downregulation of the CB2 receptors has been reported in the brains of Parkinson's disease patients. Therefore, both the activation and the upregulation of the CB2 receptor is believed to protect against the neurodegenerative changes in Parkinson's disease. THC may be able to delay the progression of Parkinson's disease and its symptoms by activating CB2 but blocking CB1 receptors. CB2 agonism was able to attenuate the induction of the pro-inflammatory cytokines and inflammatory mediators in the ROT challenge rats, and it also prevented the depletion of glutathione concomitant to a reduction in lipid peroxidation and the augmentation of antioxidant enzyme SOD and catalase. CBD might exert its major protective effect by regulating glial influence to the neurons. Also, it might be effective, safe, and well tolerated for the treatment of the psychosis in Parkinson's disease. The endocannabinoid signaling has been identified as a modulator of adaptation to stress. CB1 dysregulation plays a role in post-traumatic stress disorder. Cannabinoids might play a role in fear extinction. Synthetic cannabinoids were able to block the fear in post-traumatic stress disorder. CBD can have antipsychotic properties. It can ameliorate positive and negative symptoms of schizophrenia. Neuropathic pain occurs in 50 to 70% of multiple sclerosis patients. Cannabinoids, including cannabidiol THC spray, were effective for treating neuropathic pain in MS. Clinical trials, both with synthetic or plant-derived cannabinoids, have demonstrated clinical efficacy of the cannabinoids for the treatment of spasticity, neuropathic pain, and bladder dysfunction. Sativex treatment resulted in a significant reduction in treatment-resistant spasticity in subjects with advanced MS and severe spasticity. There was no evidence of tolerance developing with the Sativex for the multiple sclerosis. A cannabis-derived medicine was able to help treat the pain and the bladder dysfunction in MS patients. Sickle cell disease causes severe pain. Cannabinoids can attenuate the pain in mice who are experiencing this condition. Psoriasis is an inflammatory disease and is characterized in part by epidermal keratinocyte hyperproliferation. The cannabinoids inhibit the keratinocyte proliferation and thereby support a potential role for cannabinoids in the treatment of psoriasis. Also, cannabinoid receptor agonists were able to control dermatitis from allergies. CBD creams help with itching in patients with chronic pruritus. CBD was able to improve the locomotor functional recovery in rats who were induced with spinal cord lesions. It may help fibromyalgia. The use of cannabis has been associated with beneficial effects on some fibromyalgia symptoms, though a synthetic form of CBD was found to be ineffective for fibromyalgia. Patients with Huntington's disease may have neuroinflammation. THC and CBD were able to reverse inflammatory markers seen in Huntington's disease, although other studies have shown no benefits for the disease. CBD is neuroprotective in rats who were subjected to long-term brain injury. It protected against neuronal death induced by a stroke. It also increased the blood flow to the brain, and it reduced the cerebral injury in mouse models. Cannabis possesses anti-proliferative and pro-apoptotic effects, and these are known to interfere with tumor neovascularization, cancer cell migration, adhesion, invasion, and metastasization. Cannabinoids have major potential in cancer. They can induce apoptotic cell death in human T24 bladder cancer cells. CBD is able to produce anti-tumor activity both in vitro and in vivo. It inhibits the invasion of glioblastoma cells in vivo. This is a dangerous form of brain cancer. Combined with a TRPV2 agonist, CBD increases drug uptake while potentiating the cytotoxic activity in the brain cancer cells. The cannabinoid-loaded microparticles enhance cell death and decrease cell proliferation and angiogenesis in brain cancer cells. Of the 5 natural compounds tested, CBD is the most potent inhibitor of breast cancer cell growth. CBD increased the generation of reactive oxygen species, and reactive oxygen species inhibition blocked the induction of apoptosis and autophagy. It downregulated LD1 gene expression in aggressive human breast cancer cells in culture. In colorectal carcinoma cell lines, CBD protected the DNA from oxidative damage and it reduced cell proliferation. Endocannabinoids are able to inhibit cell growth, invasion, and metastases of thyroid tumors via the regulation of adenylyl cyclase, CAMP-PKA pathway, and MAPK signaling. Also, thymocytes and EL4 thioma cells were susceptible to CBD-induced apoptosis. In capsule sarcoma, CBD reduced the proliferation and induced apoptosis in the infected cells. In leukemia, CBD induced apoptosis. The CBD treatment led to significant decrease in the tumor burden and an increase in the apoptotic tumors in vivo. In lung cancer, the CBD inhibited the cancer cell invasion and the metastases. In melanoma, AEA induced the cytotoxicity against the human melanoma cells. In prostate cancer, the cannabinoids, especially CBD, are potent inhibitors of prostate carcinoma. The cannabinoids can also help with the side effects of pain from cancer and chemotherapy. Cannabis produces CBD carboxylic acid through the same metabolic pathway as THC until the last step where CBDA synthase performs catalysis instead of THCA synthase. The CBD has been found to be an antagonist at the putative cannabinoid receptors. CBD is mediated by enhancing adenosine signaling. Cannabinoids can cross the blood-brain barrier. You can increase your endocannabinoids with lifestyle and diet, stress reduction, exercise, a high-fat diet, tea, and extra virgin olive oil. Some supplements for the endocannabinoid system are CBD oils, genistein, and omega-6s. Other supplements are echinacea, nicotine, galantamine, DHA, and kava. Olamidine, caffeine, PEA, and EGCG from green tea. You have to have an adequate supply of DHA fish oil for the neurological benefits to the endocannabinoid system to work. In theory, smoking marijuana activates the CB1 receptor. Early on in life, this can make you more anxious. This happens by you not getting your GABA receptors to fully mature. This hasn't been proven in humans, only in rats. Also, CBD can be immunosuppressive. Don't take it if you're immunocompromised. Cannabinoid analgesics have generally been well tolerated in clinical trials. In humans, CBD has been shown to be safe in multiple small studies, suggesting it's well tolerated in doses up to 1500 milligrams per day orally, or 30 milligrams intravenously. In a study with 2,811 users of cannabis with ADHD, the users had more ADHD symptoms when not using the cannabis. In one study, CBD administration did not improve the brain function in piglets that lacked oxygen. Also, CBD, when combined with THC, might decrease or impair the reward learning and motivation. There's some preliminary evidence to suggest that CBD can reduce THC clearance, modestly increasing the THC in the body. This would result in more THC available to the receptors, and it would increase the effect of THC in a dose-dependent manner. Cannabis dependence is associated with CB1R downregulation, and this begins to reverse surprisingly rapidly upon stopping the cannabis. Chronic THC use might decrease and blunt dopamine receptors, since THC increases dopamine signaling, although this appears to be dose-dependent. Also, THC can cause schizophrenic-like symptoms, altered perception, increased anxiety, delayed recall time, impaired mental performance, and increased cortisol in some. Phasaracetam can help with the memory loss induced by cannabis. Smoking cannabis at a young age may cause long-term cognitive deficits. To book a consultation or to learn about herbs, supplements, and natural treatments, check out my website.